you know, the issue of the diagnosis of psychosis and schizophrenia in Black people, trauma and substance use, I think is one that really is intertwined. When I was at juvenile justice, I did a lot of deprescribing of children who had been diagnosed with bipolar or psychosis. And what really was happening was they had re-experiencing symptoms that were mischaracterized as psychotic symptoms. And some of their numbing and things like that associated with their trauma was thought of as negative symptoms. And so and again, this is observational. I wish I had a study to back it up, but my observations are that in a mental health care system that often does not think about, account for, ask about traumas that are specific to marginalized populations or race-based traumas, we miss it. And so we see the symptoms that have resulted from that trauma and put it in a box that makes sense based on the DSM, because the DSM doesn't give us a box for race-based traumas or traumas that are part of your lived experience as long as you've been alive and will continue to be. And so they get labeled these other things that may not be accurate. And so I think in some cases, yes, you may be seeing a cannabis-induced psychosis. In other cases, you may be seeing agitation, cannabis use, and a healthcare system that we know overdiagnoses Black people with psychosis kind of coming all together.